Welcome to our channel. Today, we're diving into an important topic: painless vaginal bleeding during pregnancy. Pregnancy is an incredible journey, but it can also be a bit of a roller coaster ride, right? There are so many changes happening in your body, and sometimes those changes can lead to unexpected symptoms. While some bleeding during pregnancy can be normal, painless bleeding always warrants a conversation with your doctor. So, let's get started.
Let's talk about polyps. These are small, usually benign growths that can occur in various parts of the body, including the cervix or the endometrium, which is the lining of your uterus. Polyps are more common in women who aren't pregnant, but they can definitely pop up during pregnancy too. These little guys have a rich blood supply, and even slight irritation or hormonal changes can make them bleed. The good news is that in most cases, polyps are harmless. However, any bleeding during pregnancy needs to be checked out by your doctor. Now, let's talk about a condition called adenomyosis. It happens when the tissue that normally lines your uterus, the endometrium, starts growing into the muscular wall of your uterus. This can lead to a thickened uterine wall, pain, and yes, you guessed it, bleeding. While it's more of a concern in non-pregnant women, if you have adenomyosis and become pregnant, it can increase the risk of certain complications, including bleeding. Let's unravel the mystery of eiomyomas, or as they're more commonly known, fibroids. Fibroids are non-cancerous growths that develop in the uterus. Certain types, especially those located within the uterine cavity or those that distort the shape of the uterus, can cause bleeding, particularly during pregnancy. Imagine a tiny balloon expanding inside your uterus. That's kind of what a growing fibroid does, and it can irritate the surrounding tissue, leading to bleeding. However, your doctor will want to monitor them closely throughout your pregnancy. Let's talk about a more serious but thankfully rare cause of bleeding during pregnancy: malignancy, which is another word for cancer, and hyperplasia, which is an overgrowth of cells. While these conditions are uncommon during pregnancy, certain types, such as cervical cancer, can cause painless bleeding. If you experience any unusual bleeding during pregnancy, your doctor will likely recommend some tests to rule out any serious conditions. Early detection is key, and the sooner any issues are addressed, the better the outcome. Let's shift gears and talk about coagulopathy. This term refers to a group of conditions that affect your blood's ability to clot properly. During pregnancy, having a coagulopathy can increase the risk of bleeding complications, so it's essential to let your doctor know if you have any history of bleeding disorders. There are various reasons why someone might have a coagulopathy. It could be genetic, related to certain medications, or caused by other underlying medical conditions. Let's talk about ovulatory dysfunction. This refers to irregularities in ovulation, which is the release of an egg from the ovary. While ovulatory dysfunction itself isn't usually a concern during pregnancy, it's important to be aware of the other potential causes we've discussed. Let's talk about iatrogenic causes. This might sound like a complicated term, but it simply refers to any health problem that's caused by medical examination or treatment. In the context of pregnancy, this could include certain procedures or interventions. However, like any medical intervention, there's always a small risk of side effects, and bleeding is one of them. Let's explore endometrial causes of bleeding. The endometrium, as we've discussed, is the lining of your uterus, and sometimes it can become inflamed or irritated, leading to a condition called endometritis. This inflammation can be caused by various factors, including infection. If you have any concerns about endometrial causes of bleeding, it's always best to err on the side of caution and consult your doctor. Finally, let's acknowledge that medicine, as advanced as it is not always an exact science. There are times when a cause for painless vaginal bleeding during pregnancy might not fit neatly into any of the categories we've discussed. The human body is incredibly complex, and there's always more to learn. If you experience any unusual bleeding, don't hesitate to reach out to your healthcare provider.
So, there you have it. A comprehensive look at the potential causes of painless vaginal bleeding during pregnancy. Remember, this video is for informational purposes only and shouldn't be taken as medical advice. If you're experiencing any form of vaginal bleeding during pregnancy, it's crucial to seek immediate medical attention. Thanks for watching, and don't forget to like, share and subscribe for more informative content.